What do CEA tumor marker levels mean for colorectal cancer? Imagine you're getting a routine blood test and your doctor checks your carcinoembryonic antigen levels. You might wonder, what do these numbers really tell us about colorectal cancer? Well, CEA is a protein that is usually present in tiny amounts in healthy adults. But in people with colorectal cancer, especially when the tumor is active or spreading, CEA levels in the blood can become higher. Measuring these levels helps doctors get a clearer picture of how the disease is progressing or responding to treatment. When a person is diagnosed with colorectal cancer, a CEA test is often done before any treatment begins. If the CEA level is above 5 nanograms per milliliter, it can suggest a more aggressive or advanced tumor. Higher levels, especially over 10 or 20 nanograms per milliliter, might indicate that the cancer has spread or is at a more advanced stage. But it's important to remember that not all colorectal cancers produce high CEA levels. Some tumors may not elevate CEA at all, which means a normal CEA doesn't necessarily rule out cancer spread. After surgery to remove the tumor, doctors usually check CEA levels about 6 weeks later. If the surgery was successful and all cancerous tissue was removed, these levels should drop back to normal. If CEA remains high or starts to rise again over time, it could be a sign that some cancer cells are still present or that the cancer has come back. That's why serial measurements, taken every 3 to 6 months during the first 2 years after treatment, are so helpful. They help detect recurrence early, when additional treatment might still be effective. It's also important to understand that other conditions can influence CEA levels. For example, liver disease, pancreatitis, or even smoking can cause elevated CEA. So, doctors interpret these numbers carefully, considering the whole clinical picture. CEA levels are a useful tool, but they are not a standalone test for diagnosis. Instead, they work alongside imaging tests and other assessments to guide treatment decisions. In summary, CEA tumor marker levels provide valuable information about the presence, extent, and recurrence risk of colorectal cancer. They help doctors monitor how well treatment is working and whether the cancer might be returning. However, because CEA can be influenced by other factors, it's always essential to discuss results with a healthcare professional who can interpret them in context. Regular testing and personalized medical advice are key to managing colon health and improving outcomes.